Month, so it's appropriate that we have this discussion. My name is Diana Rivera. I'm your moderator and participant in today's discussion. I'm a behavioral health professional, licensed clinical social worker at Morton East Adolescent Health Clinic, part of the ambulatory community healthcare network for Cook County Health in the town of Cicero. I'm a therapist, social worker, advocate for 15 years now, and with CCH for 8 years. And mental health is a significant priority for me. I provide mental health therapy treatment throughout the lifespan, but my areas of interest are working with children, adolescents, young adults, and families. Born and raised in the south side of Chicago, working within the community clinics allows me to give back to the communities I grew up in, and I'm honored to facilitate this very important discussion. Today, I'm grateful to be joined by our wonderful panelists of experts, and we recognize Mental Health Awareness Month and discuss how you can access care or some of your loved ones can access care. Before I introduce my panelists, before they introduce themselves, I'd like to note that this is a live discussion, so we welcome any questions into the chat. Now I ask our panelists to briefly introduce yourselves. Dr. Vergara, you could start us off.
Thank you. I'm also really honored to be here today to celebrate mental health awareness. That's not just for all of the community, but even for us people working in the healthcare field where we need to care for ourselves to care for our communities. My name is Pamela Vergara Rodriguez. I'm an internist and psychiatrist, and I'm the director of psychiatric services at the Core Center, where we provide treatment for infectious disease. And for the last 20 years now, I've been here treating people with infectious diseases and also treating folks that are part of the LGBTQ community. So I pass the baton to Dr. Patricia Hoyos.
Hi, I am Dr. Patricia Hoyos. I am a psychologist at Stroger Hospital, Division of Child and Adolescent Psychiatry. I have been with CCH for 10 years. Before that, I was at other institutions on the west side and south side of Chicago, serving these great communities as well, for children, primarily children, adolescents, and families.
Terry, do you want to go next?
Sure. I'm Terry McKean. I'm a licensed clinical social worker, and I'm the Director of Crisis and Support Operations through NAMI Chicago. So that means I oversee both our NAMI Chicago helpline and our 988 call center. I've been working in crisis work for the past 15 years, primarily with children, adolescents, and young adults, and I've expanded that now into the full lifespan, and it's very exciting to be part of NAMI Chicago and our offerings in Cook County.
Thank you. Danielle?
Good afternoon, everyone. Thank you for having me. I as well am excited about Mental Health Awareness Month, but also just mental health in general. My name is Danielle Fultz, and I'm the manager of Justice Involved Services for the CTSC at Providence Hospital. I have a history of working with patients with mental health issues and also working with substance use disorders.
Thank you. Thank you for those introductions, and thank you for taking the time to discuss mental health. So 1 in 5 individuals in this country have experienced mental health concerns. And I think we've all had times when we felt sad or worried, but at what point should someone be reaching out for help? Dr. Vergara, would you like to answer that question first?
Sure. I primarily work with adults. So I think that when we experience emotions that are getting us down or making us feel a particular way, we absolutely should seek support, talk about it, become aware of them. But the real issue is when a person is having a change in their ability to function, and that could be at work, it could be at home, just doing regular everyday routine stuff like cooking, showering, losing motivation to do those things, or even as a parent, not feeling up to doing those things we need to do to get those kids out the door, or as a daughter, or as a sibling, or as a friend. When we start seeing a change in function, we need to have a heads up and either ask around for some support, look for actual professional support, or see what is happening or contributing to what is going on with us. It's really that change in function that alerts us that something important is going on, that a change is happening.
Dr. Hoyas?
Yes. So in kids, you want to look for a change in their behavior because kids are not just going to come out and tell you what they're feeling. You're going to really want to pay attention to what they're doing, to their behavior. So you might see like increased behavior problems at school or at home, dropping grades is a big sign. Maybe they're more withdrawn and retreating to their room all day more. And these, again, are changes in their functioning at home and at school. And maybe they're reacting to something, maybe something difficult that happened, like a loss or a traumatic event, or maybe being bullied at school. That's a big one. And they don't know how to express their feelings, or maybe they don't really want to talk to a parent about it. Teens, sometimes they don't want to talk to parents about stuff, but they need to talk to somebody. So it is important to reach out because they shouldn't be dealing with these things alone.
Right.
Mm-hmm.
I totally agree. And what can that look like? What does help look like?
I can jump in real quick. For our helpline, people can call anytime, especially if they don't know what help looks like, or if they're not sure where to turn, or if that problem even is worthy of help. I have a lot of people who call who aren't sure that they want to bother anybody or be a burden, or not even sure where to ask or what the question to ask is. And they can seeking out help, and calling our helpline, for instance, is a great way of just kind of sorting it out a little bit. What are my next steps? Who should I talk to? Is it right to go to my primary care doctor? Is it right to get more specific health care, like with a psychiatrist? What would be my options? I think that's an important thing to think about.
Right, great. Dr. Vergara?
So when we think about what help can look like, there's so many different levels of help, just like Terry was mentioning. And I think it's a great idea to call a helpline if you're not sure where you meet, or maybe you're someone who wants to actually get online. The NAMI website, I think, is an excellent starting point for just getting information. But the kinds of help that are available that you can access really also depend on what you're looking for, as well as how bad the situation is, right? So talk therapy might be one type of help that we can give, just talking with someone, but there's another level of treatment that sometimes people will get, which involves medications. And a lot of times that step begins with your primary care doctor, because that primary care doctor is going to be able to identify that there is a problem that needs to be addressed. And should that problem potentially be addressed with therapy? Should it be addressed with medication? Or maybe it should be addressed with both. There are lots of other types of help too that are very important that we often don't talk about, which is group therapy. In situations, for instance, like grieving, grief groups support can be super helpful. Or for other types of situations where people might be dealing with substance use issues, group therapy groups are very helpful to be able to get support. So from our end at Cook County Hospital, we have individual and group therapy available. We also have medication management, which is done with the psychiatrist. And all of this happens on an outpatient level. We also have treatments that are available for substance use that are very important, medications given both in the primary care setting as well as the psychiatric setting. So all of these services are available at Cook County for adults.
I'm so glad that you mentioned groups, because I am a huge advocate of groups. I think they're very impactful. It's creating a safe space for community, a brave space, which allows our patients to share their experience, feel a sense of self-compassion, build resiliency, and develop healthy coping skills. So I facilitate groups here at Morton, some anxiety reduction groups, trauma-informed groups, so grief groups like you mentioned. So I'm glad that you talked about groups, because I am a huge advocate of groups, and I've seen some amazing healing happen during groups. So Dr. Hoyas, do you have any
Yes. So with children, what the help that you get will look different depending on what the needs that are being presented are, and also the age and developmental level of the child. So we can do like the individual traditional talk therapy that Dr. Vergara was talking about, maybe with older kids and the teens, young adults. We can also do play therapy using games or art or toys for younger kids or even older kids who prefer like not to express themselves verbally, or maybe you kind of want to access a younger part of their lives, and you can use some play therapy even with the older kids or even young adults. We also have family therapy, because kids do not exist in a vacuum, right? They don't exist in a bubble. They exist in the context of a family and a community. So you can have family therapy either with the whole family or parts of the family, maybe parent-child or sibling, where you can address different parts of relationships, any kind of relationship issue or family issue that's going on. We also have what's called Triple P. It's a positive parenting program, and it is a validated treatment that teaches parents positive parenting strategies that's going to help strengthen their relationship with their child. It's going to help them encourage positive behavior in their kids, teach them new skills, and manage difficult behavior. And we do that both individually and before COVID, we were doing in-person groups, and now we are coming back with the group setting virtually. And like you said, that is really great in groups because parents can support each other with these difficulties. Sometimes, you're at a loss as a parent. You don't know what to do. And talking to other parents could be really helpful and validating. Also, as therapists, we may also have conversations with the teachers, other school staff, because, like they spend most of their day in school. So you want to have that communication with the school to help them with that. And sometimes if there is like a developmental issue or learning issue you want to know more about, we also have a psychologist that does psychological testing. And then you can bring the results of that evaluation to the school to get the services that they need in school. We also have child psychiatrists. They specialize in children and adolescents. If medication is something that's needed, then we have psychiatrists on staff as well.
Right.
Mm-hmm.
So many great.
I also wanted to just point out, we have Danielle Foltz here. We have services for people in acute need, like when they're immediately needing or they're in a situation of crisis. And it's important to know that service is available. Danielle, I don't know if you want to speak to that crisis service now that we have. You're muted.
Yes. We have the CTSC, which stands for Clinical Triage and Stabilization Center. And basically, this program is designed to provide 23-hour rapid crisis stabilizations to patients experiencing psychiatric crisis. So individuals come into the hospital and they are experiencing a crisis, or just have a crisis situation. They can come into the hospital. They can let the staff know that they're experiencing a crisis. And what ultimately happens is, we will be contacted. We are right on the first floor of the hospital in Providence, and they'll let us know that the individuals experiencing a crisis, what's going on, and we will go over our EPRNs. We'll go over and meet with the patient immediately.
Awesome. That's great. That's amazing work that we're doing in our system. And I could talk a little bit about some of the treatment that I do with some of the young people I work with. And I do a lot of somatic work. So we do a lot of breathing exercises and grounding practices and meditation. And I'm sure one of my goals is if I never see a patient again, at least we've done a breathing exercise together and they know how to be in tune with their body when they're feeling overwhelmed, when they're feeling sad. And, they're able to leave with a tool in their back pocket, which is just deep breathing. So that's one of the approaches that I use. Another question I have is oftentimes there's a stigma when it comes to mental health treatment and medications. How do you determine if medications can help? Dr. Vergara?
I think that we want to make sure that if we are offering medication, that it is for an appropriate diagnosis. I think that it's important for the community to know that just because you have a mental health problem doesn't mean that medication is the only treatment available. There's a lot of stigma about medication. So it's important for us to reassure everyone that we're not going to offer medication just like that. It's really meant to be for someone who has at least moderate or severe functional loss, meaning you're having a serious change in your ability to do your everyday life, right? And when we give those medications, we want to make sure that we're giving the right monitoring, right? We're not just going to give you a medication and then not have a follow-up to make sure that you're doing okay with it, you're feeling okay with it, that we're checking to make sure you're not having side effects or that it's not impacting something else in your life, right? How we can be able to overcome the stigma is difficult because I think we can all agree we would love it if none of us needed medication, if we were all so healthy that we could just live very healthy lives and not need it. But unfortunately, that's not the case. There are some times when people are very ill and they need the medication, and we have to be careful with our families, with our friends, with each other, to acknowledge that if someone could be better without meds, they probably would be. If someone could be not depressed and just be better, they would choose to be that better. But because they can't, then sometimes we need medications to help, not necessarily forever, but at least for a period of time. And I think that's important to know forever. Lots of people have questions of how long am I going to be on? Is this going to be forever? Well, we don't know, right? We don't know if anything is forever. And that's why it's so important for us to know and develop that relationship with a particular provider, whether it's a medical doctor, whether it's a nurse practitioner, whether it's a psychologist, to develop that trust that when medications are started, that all those questions and that all of that following and monitoring happens the way that it should, because we don't want a medication doing the wrong thing. The purpose of the medication is for it to do a right thing, right? So we want to make sure that we don't make people feel badly about needing medication, asking for help, complaining about their medication. That's okay too, right? Or wanting to change, right? Wanting to change medication. So there are times when we need to acknowledge that sometimes medication is necessary, particularly when we're talking about more severe mental illness, right? Particularly when we're talking about disorders like schizophrenia, or particularly when we're talking about disorders like bipolar disorder. These are disorders where oftentimes we really do need to use medication.
If I can add a little bit as to that, just from kind of my patients, that the concerns I've heard, especially with kids, parents are often concerned about how is this going to affect my child's body, their growing body, their development. And so and they have all sorts of ideas that so-and-so told them, or they heard online, or this, and I always tell them the most important thing is communication with your psychiatrist. Make a list of questions, all of your concerns, and ask about them, because people are often getting misinformation about medication and the effects on themselves, on kids. And also, medication is not just for, yes, it's for maybe people who've had some moderate or severe issues, but sometimes there are some issues that are just have a really strong biological component, not necessarily means, oh, it's this extreme illness. For example, ADHD, right? A very common with kids, and it has a very strong biological component. So the studies have shown that for some of these issues, the combination of medication with therapy or medication with parenting training is the best way to help your child. In addition with whatever adaptations needed in schools. So it doesn't necessarily mean, oh, it's just you have an extreme mental illness. It may just mean there's an issue that has this biological basis, and encourage you to have complete open communication about all of your concerns with your psychiatrist about medication.
I agree. Empowering the parents, educating the parents.
Mm-hmm.
I think that's a great stigma around medication. Another question, we know that young people are really struggling. What are things that people should know or recognize in their children?
So signs of issues, mental health issues, will look different at different ages, right? So in early childhood, you might see a regression in skills. Maybe their speech is going backwards. They were toilet trained and maybe now they're not. They were doing things on their own and now they're just kind of asking for help more and whining, a little more clingy. You might see that. You may even see, like, even more severely, separation anxiety, where they get very distressed if they're separated from their caregiver, and just have like these attachment issues with that are either just kind of turning away from their caregiver or very anxious when they leave. Maybe you'll see more tantrums beyond what's developmentally expected, right? Because at certain ages, you're going to see tantrums. That's normal. But if it's beyond and they're longer and more intense and more frequent than what's developmentally expected, that could be a sign too. Lots and lots of fears. Again, some fears are normal at certain ages, but if you're just seeing a lot of the dark, of animals, of being alone, of a lot of things, then especially if it's a change in what you've seen before. At school age, you want to look at dropping grades. That's a big sign. Trouble staying focused at school, having behavior problems at home, at school, having emotional outbursts, just not controlling their emotions very well. In preteens and teens, maybe you're going to see a little more defiance or acting out or anger outbursts. Again, more than what's developmentally expected. In teens, you're going to see some of that. But if we're talking about huge explosions, punching holes in walls, happening every day, really having trouble calming down, that's different, right? Excessive screen use, which is a change in the way they were using screens before. Some kids are kind of more screen kids, but if you're seeing a change, if suddenly they're like on their screen all day and you feel like it's kind of a retreat, they're trying to avoid the real world, that's a change. That's something to pay attention to. Substance abuse is another sign. Self-harming. Be aware if your kids are wearing sweatshirts, long sleeves in the summer, what's that about? Spending excessive time in their room and like in their bed, sleeping all day, or trouble sleeping at night. And making suicidal statements. Always take those seriously. And look for help with those. So those are some signs.
Great. Yeah, that there's a lot of things to be looking out for when it comes to young people. Mm-hmm. What do you think are some of the biggest challenges young people face when it comes to mental health?
Well, since COVID, we've actually been seeing a shift in certain things. We're seeing a lot more depression and suicidality. We're seeing a huge increase in social anxiety, and just negative feelings about themselves and their body. They were just kind of like isolated during COVID and then thrown back into this social setting. And it was, especially when kids were maybe preteen or teen when they went into COVID, it's like this big chunk of time that was really impacted. Their social emotional development during that time was really impacted. And so you're kind of seeing these things now and still today, like the social anxiety and body dysmorphic issues. Currently, we're also seeing a lot of kids who are very anxious about themselves, their families, and their future in reaction to just things that have been happening in the world today. So we're dealing with that.
Absolutely. I think when we talk to young adults, Gen Z, they're concerned about that the world and the environment of the world is so uncertain. It makes them feel hopeless and helpless and sometimes unmotivated, right? To continue to think about their own future, what they want in the future, if they feel that the world is not really going to be able to offer them the future that they would like.
Yeah, I would support that. We hear that on the helpline quite a bit of this just overwhelming kind of anxiety. That's dread, maybe that's a good word for it. But the uncertainty is just so profound in so many different ways, how it impacts their immediate family, how it may impact their healthcare coming up, going to school, for instance, in the future. What is that going to look like? What kind of life am I going to lead based on all the uncertainty that's been going on? We hear that quite a bit.
I agree. Recently, Cook County Health announced that it was investing in NAMI's helpline. Terry, can you talk about the helpline and how people can access it?
Yeah, absolutely. So the helpline has been around for quite some time. We are a no barriers, all access kind of space for anyone who has questions, concerns, needs a space of just some emotional support. Like I said earlier, we just have to sort things out a little bit and figure things out. What's my plan next? And we can handle crisis calls too. So if people really are not sure where to turn and they're feeling a lot in crisis, we can be a support space for that as well. What's exciting is with this support we're getting from Cook County Health, we've been able to expand our accessibility. So previously it was a phone number, 833-626-4244. And now you can also text us. So you text helpline to that number and you'll be automatically connected to one of our call takers, or you can chat with us on the NAMIChicago.org /helpline website. A chat box will come right up and you can chat with someone. So it's really expanded accessibility. People are not always comfortable with phone calls. Speaking of the younger generation, they don't like to make phone calls. But so they can text us and they can chat us as well to get the same level of support. And we can handle anything along the lines of, again, emotional support, education, referrals, and crisis. We can handle all of those things.
So how does this differ from other helplines? Because I know there's that 988. How does this differ from other helplines that are out there?
Yeah, good question. So there's kind of 3 different levels, I guess, of phone calls that you can make. You can call a warm line. Those tend to be more of a quicker conversation. They're not always accessible. Maybe you have to leave a message to get a hold of someone. You can call a helpline like ours. We have hours from 9 to 8, Monday through Friday, and 9 to 5, Saturday and Sunday. We try to answer live all the time. But we can take voicemails. We'll do callbacks, things along those lines. But we're not intended to, I guess, do that immediate crisis support. We can handle it if it comes in, but that's not our spot. Our spot is really to be a space of holding, a space of talking through whatever you're experiencing and kind of figuring out what's our next steps, what's going to be most helpful for you now. Was it just talking to me and that's great, you feel a lot better? I'm glad for that. But maybe it is you need resources and referrals to some other different types of treatment or other expertise or other resources that are out there. Maybe housing is a complication for you as well, or financial issues or food access. We can kind of connect you to those other resources as well. Where a hotline like 988 is answered live, they're generally 24/7 and they're intended for, I need something right now, an acute space. So similar to what Danielle is dealing with, where somebody's walking, instead of walking through the door, they're calling us on the phone and we may be directing them to somewhere like what Danielle's has, or de-escalating on the phone if we're able to, or utilizing other services.
Nice, that's awesome. So I do find myself promoting these helpline resources to patients who are struggling with limited support or have negative thoughts. So I'm excited about this partnership. This question is for Danielle. We know that sometimes people need immediate help. Can you talk about the Provident Clinical Triage Stabilization Center, the CTSC, and what makes it unique?
Yes, we work with adults 18 and up. Our program would assist with reducing crisis symptoms by offering 23-hour observation by a team of APRNs, behavioral health nurses, MAs, recovery coaches, behavioral health associates, social workers, and the medical director. We help patients that are experiencing anxiety, panic attacks, depression, mood swings, patients coping with trauma or loss, patients that have been recently discharged from hospitals and or correctional facilities. And we also work with patients that may be at risk of harming themselves. Now, what makes our model really unique is our model is different from other hospitals. Instead of hospital beds, we provide the patient with recliners. The CTSC provides care in a calming and supporting environment without the patients having to stay in the hospital and or emergency room department. Our main focus is the patient's comfort, safety, and their stability.
What happens after someone leaves the DTSC?
Well, upon completion of the 23 hours, the patient is discharged with appropriate support services. First and foremost, we make sure the patient is discharged with a safety plan, and that's accompanied with any type of follow-up appointments that they need in the community, medication instructions, referral for outpatient services that can include therapy and/or psychiatric services, and any other resources that will support their mental health needs in the community.
Okay, thank you. We talk a lot about destigmatizing mental health and seeking help. What does that really mean, though, and how do we do it? Dr. Vergara, would you like to chime in here?
Yes, I think, the number one thing is understanding that mental health and physical health and spiritual health, emotional health, these are all together. They're part of us being one complete person, one complete human being. And our goal really should be to provide holistic health, the mind and body together. Our body can't be okay without the mind, and the mind can't be okay without the body. So if we want to live the beautiful, productive life we want to, and have friends and have, a good job and enjoy ourselves, then we have to also work on having good mental health. And I think that's the number one stigma point that we can, okay, so, you say mental health is an issue, but can you really have good health without mental health? You can't. So we have to get over our idea of that these are split things. And one of the ways we can do this is by making sure that people can seek mental health services first through the road of seeing their primary care provider, and making sure that primary care providers are able to have those discussions with their patients and then refer when it's appropriate. But the primary care provider really is that point person who can say, oh, this person is having a mental health issue that's affecting their physical health issue, or this is a mental health issue that just really needs to be addressed by a higher level of care. So, making sure that we have that stepping door through primary care is very important to reduce stigma, because lots of people don't necessarily want to go directly to a mental health service place, right? But that mind and body connection, that's for everyone. And that's, in a lot of ways, that's what Mental Health Awareness Month is about, right?
Holistic approach.
Yeah.
This question is for everyone.
So can I chime in a little bit on that too as well? Yeah. So I think, the destigmatizing mental health is about presenting it as preventive medicine. And we do that with an integrative medicine or medical home model. We have an example of that here in our AYAC clinic, Adolescent Young Adult Clinic. And it's an integrative medicine or medical home model. And it addresses the whole person, body and mind. And it's like a one-stop shop. It's a clinic, you go see your medical doctor for whatever, your checkup or your regular checkup or any medical issues. And at the same clinic, during the same appointment, you see a mental health professional who is integrated into that clinic. And we've been doing that for many, many years with that Adolescent Young Adult Clinic. And it works really nicely because you're just right there, like right away. You just, you don't even have to leave the room where you are. Psychologist comes in and talks to you about whatever mental health issues are presenting.
Okay, one-stop shop, right?
Yeah. Mm-hmm.
So this question is for everyone. What's one piece of advice you would give to someone struggling with their mental health? Dr. Vergara, you can start us off.
I would just say, you are not alone. Don't let yourself be alone. Reach out. There is someone else feeling just like you. I promise you, if you do that reach out, you'll find that out. You're not alone.
Thank you. Danielle?
I would say it's okay to seek help. It's okay. We're here to help. We're here to provide you with the services. We're here to, provide you with the coping skills or whatever that you may need to assist. So it's okay to seek help.
Terry?
I echo both of those. I think that's really, really important. I think the other thing too is to trust yourself. I think part of the stigma that plays into that is we have, as a society, stigmatized mental health in such a way that people don't trust their own intuition that something isn't right. And I think that's a really important place. Like, you know yourself best, and you know what potentially could be helpful, or at least minimally that you need some extra support and help. So trust yourself and seek out that support.
Dr. Hoyos?
Yeah, I think in addition to reaching out to a mental health professional, reach out to the people and resources in your life, like family, friends, church, your primary care physician, community organizations, etc. Because building a healthy social support network is the single most important factor that can protect your mental health and build resilience.
Well, I believe everyone has a unique journey. So seek support. Therapy really works. If you have a negative experience with therapy, that's okay. I just encourage you to seek another therapist until you find a good fit. You matter. You're worthy. I see you. But this was a great discussion. I'm so happy and proud to be a part of this. I want to express my gratitude to everyone participating today, whether you're a panelist or a viewer. We want to emphasize that you are not alone. And I hope that hearing about the various methods of mental health resources available we can offer can help those who are struggling. And remember, Cook County Health can offer care for all mental health needs all year round, regardless of your ability to pay. We'll have our resources down in the chat, but you can call 312-864-0200, and it's okay to ask for help. So I hope we continue this conversation. I hope it continues going when it comes to mental health, so that everyone can feel supported and heard. And happy Mental Health Awareness Month. And thank you, everybody, for today, for this chat.
Thank you, everyone.
Thank you.
Thank you.